The main purpose for establishing the National Health Insurance Authority is to enable the enrollee access healthcare without any form of stress or payment. Sometimes there are violations which can distress stakeholders and hinder the achievement of objectives of the scheme. When this happens, the scheme has a way of enforcing its provisions and restore the values of the NHIA. And that is what we shall be looking at in this episode of Easy Access to Healthcare for All. NHIA Redress Mechanism, Enforcement and the Gains from it. My name is Aisha Muhammad Ahmed, your host. Do stay tuned for details after this time out.
Give ship moves, leaving no one behind. Give ship moves, leaving no one behind. Give ship moves, leaving no one behind. Give ship moves, leaving no one behind.
First on the program is a highlight of news events around the NHIA. In our lineup, NHIA holds negotiations with pharmaceutical manufacturers and drugs management organizations. In other news, NHIA participates in anti-corruption and transparency workshops. Details shortly.
The National Health Insurance Authority, NHIA, recently held a meeting with pharmaceutical manufacturers and drug management organizations. The meeting is to help the authority finalize its Medicine Supply Initiative, which is a program that will provide enrollees with drug security and cut down the out-of-stock syndrome bedeviling the health insurance sector. In his remarks during the event, Director General NHIA Professor Nasir Mohammed Sambo, who was represented by General Manager Standards and Quality Assurance NHIA, said the meeting was an effort of the NHIA to make progress on the NHIA Medicine Supply Initiative. Speaking further, he said the move will give pharmaceuticals the opportunity of exploring ways of ensuring the availability of drugs when enrollees visit hospitals.
As NHIA is worried about this, I believe you're also worried, because even the product that you put out there that we try to dispense under our scheme, we've had challenges where people are saying they are substandard drugs, and we know that they are not substandard drugs. When we talk of generic, we know the difference. So today we are looking at how do we change the perception of people. How do we increase your hold on the market shares that you're able to control in Nigeria? How do we also get our own enrollee on our side to begin to look at drugs and say, yes, they are quality drugs? How do we begin to work with you to make sure that people don't go to hospitals and the drugs are not there, to community pharmacies and they can't find drugs?
Whatever is agreed upon in this room means a lot to Nigerians, including our relations.
Stakeholders speak on the impact of the meeting and the Medicine Supply Initiative.
What we expect is a lot of improvement in health delivery system in the country, particularly in NHIA stock. We are doing branding of NHIA drugs in order to make it cheaper, accessible to the common man on the street. We're now going into universal health coverage. And if we're going to universal coverage, it's going to be a very big volume of market in terms of the drug. We're trying to tell the pharmaceutical industry of Nigeria to bring down the price of drugs, get it available so that the common man will have all the drugs. So the time for out-of-stock syndrome in hospitals is gone.
It's been a well-synthesized project. And little by little, we had meetings within FCT, we had outside FCT, we had virtually in all the regions of the country. And today, we can see that what we have on ground is that we've reached the level of getting nearer to our destination. Now at the level where we have to make sure we do negotiations with those who are successful in the bid to manufacture these branded medicines for the NHIA, bear in mind that quality, consistency, and pedigree become very important as tools to be used in this type of assignment.
In order to what? To sell the...
In line with his agenda of engendering transparency and accountability in the entire operations of the authority, personnel of the National Health Insurance Authority, in collaboration with the Independent Corrupt Practices and Other Related Offences Commission (ICPC), attended an Anti-Corruption and Transparency Unit (ACTU) at the Anti-Corruption Academy of Nigeria (KEFI).
You are right, aims where...
The workshop, which focused on strategic communications, aims at developing, promoting, and safeguarding a culture of integrity in the workplace, identifying social norms and behaviors that inhibit effective communication, providing appropriate countermeasures in addressing those norms, and engaging strategic communication skills in improving governance. Suleiman Ibrahim, Head of Reforms, NHIA, threw light on the workshop and how it affects the NHIA.
One of the policies of ICPC is to take their mandate, that is to implement their mandate by ensuring that there is an embellishment of ACTU in every parastatal. So the presence of ACTU in every parastatal ensures that the officers or personnel in the public service are at very close range with anti-corruption fights.
Bola Adekunle from Media and Public Relations Department also shares her thoughts.
We have a mandate which is making sure that all Nigerians come in, and we can only do this by having that passion, loving our country, seeing people's lives there, probably sick, we are not concerned, no. But this training has bring about the ethics by working with passion, making sure Nigerians come in, by doing our work well.
The program is easy access to healthcare for all. What does the NHIA do when it discovers that its operational guidelines are not being adhered to? What is the medium through which enrollees can seek redress when they encounter problems in the course of accessing care? These are important questions that answered in our next segment, issues around the NHIA, as we look at the NHIA redress mechanism. Keep watching.
The National Health Insurance Authority was established to give Nigerians easy access to health care without having to worry about out-of-pocket expenses. Enrollees who have benefited share their testimonies on how health insurance has made medical care easier.
Well, I'm married to a nurse, so by virtue of marriage, I became a member of NHIS. When I had my daughter, when my wife was pregnant for my daughter, so many drugs other people pay for, I don't think I have ever paid for anything of such. Even when I had my child, and then I know how much people pay at the hospital, but I think I paid almost nothing.
We know to seek is not easy, but when we go to hospital because of NHIA, we really feel good. They attend to us very well and quickly. They give us drugs. We just take everything home as if it's short. It's freely because of NHIA.
The NHIA functions in a tripartite system to make accessing care seamless for the enrollee. The NHIA acts as the regulator who accredits the health maintenance organizations who implement and manage the funds, acting as the middleman between the NHIA and the enrollee, and the healthcare providers who are accredited by the NHIA to provide the much-needed healthcare services to the enrollees. All of these activities are guided by the NHIA Act as well as the operational guidelines of the scheme so that the NHIA can achieve its goal of giving healthcare to Nigerians. To further ensure that it achieves its mandate, the NHIA set up the Enforcement Department.
The mandate is to ensure that the provisions of the operational guideline and the NHIS Act are being strictly adhered to by all the stakeholders of the scheme. And this is in a drive that is for the scheme, that is to attain its own objectives.
The Enforcement Department in the NHIA is a medium to seek redress by enrollee in the event of a breach.
For the enrollee, their first port of call should even be the HMO. So enrollees are supposed to know their HMOs, have their contact numbers or their emails. So it's when they have made that report and then they do not get any satisfactory response, then they can report to the authority. And we say that enrollees reside in the states, their facilities are in the state they reside, and then NHIA has offices in all of the states, so they should walk to the state office as a walk-in or in person to make their complaint, or they could call. Most of the state offices also have numbers that people could call, or they could write to the state coordinator or through their email. So when they do that, like I mentioned earlier, there's a request for intervention form, and this form contains a section where they ask them for all of the documents that will ease the investigation officer's work. So in that case, they may be asking for receipts of payments, any other evidence that will surely show that, oh, I went to this facility and I paid for something. So if they paid for something, then they will certainly have a receipt for that payment. So that's one of the things that whoever is investigating will be asking for.
One other tool the Enforcement Department has employed and has yielded results is its redress mechanism that gives the enrollee an opportunity to seek redress.
Now we'll start seeing one form of trend whereby there is a violation of a particular provision of the claim processing aspect of the scheme. The healthcare facilities will not submit their bill in good time after they offer treatment at the secondary or tertiary level. The HMO is not even tracking what we call the authorization, because that is a permission that he has granted for them to be treated at the secondary level. He will also sit down. But he failed to realize that whatever code he has given, it will translate into monetary aspect, a claim that may likely come. So you find out that over time, this thing become very cumulative. And it reached a limit whereby it is trying to affect the service provision at that particular levels. Therefore, NHIS now have to step in. And it has to step in quickly and in a very strong way to be able to carry out that particular exercise called reconciliation, where we now collect all the alleged indebtedness, because we still call it as an allegation. If you are complaining that this particular HMO is on you, we call it what's called as just an allegation. So you submit. When you submit, we pass over that allegation to the HMO, and then we now bring all the two parties to come to the NHIS office, which in this case, that exercise was conducted in all the 38 state offices of the NHIS.
In order to serve its enrollees efficiently, the new NHIA Act stresses the need for complaint and redress mechanism.
When I was talking about how important the complaint handling mechanism is, I mean, if you begin to get frequent complaints about, so probably I'm asked to pay out of pocket in a facility, or there is always out of stock, of medicines and so on. So it gives us an inkling that something is amiss, and so we move in. So even while we are investigating, we also want to do, like I said, a compliance assessment, a reactive compliance assessment, so that we also see other systems there that are not doing very well. So what it affords us in terms of the quality of care that you're asking is that once you get a complaint, it's a trigger that something is amiss. So at the end of the day, if you're able to resolve those complaints, then you will have increased the quality of care.
Upon receipt of a complaint, how does the NHIA go about resolving the issue?
Once we pick this, then we now look at the case, and if there's a one we direct it back to the state to carry out initial investigation. After they do their initial investigation, they will come up with the outcome. And then now we compare with what we said. If there is any infraction being detected, they also advise accordingly on what should be done on that particular issue. If there is a sanction, they will recommend what sanction. And if there is no sanction, they will resolve the issue. Everybody will be happy. Then they will submit the report to the head office.
The redress mechanism of the NHIA alongside other activities of the Enforcement Department have yielded a lot of gains, both for stakeholders and the NHIA.
With these processes now, we are getting confidence. Now, there is a confidence from the stakeholders on the regulatory aspect of this scheme. As we know, part of what we call almost all regulatory bodies, they must need to have an efficient way in which they handle complaint and grievance from their stakeholders. Once we find out that we strengthen this capacity to handle this and we efficiently carry out the activity if they arises, I think it will build that confidence from the stakeholders.
The NHIA has 38 state offices across Nigeria that are equipped to take the complaints of enrollees and healthcare providers. And if it is the HMO that has a complaint against an enrollee or a healthcare facility, the HMO reports to the NHIA directly.
Welcome back from that break. The enrollee is a very important stakeholder in the health insurance agreement. It is safe to say that his level of satisfaction with the services provided by the NHIA is a yardstick that can be used to measure the success of the scheme. We will start with Barrister Adaize Johnson, an NHIA enrollee under the formal sector who has benefited from the scheme and is satisfied with the implementation.
When my baby was due, he was not forthcoming, the labor wasn't forthcoming. The doctors were like, okay, fine, I had to go to CS. And to go and have it, I went to CS. But the charges, I think the government took it off from me. Like the NHIA was able to pay everything, the debt, everything was cleared. I was given a book to like signing out, and I was attended to, like I was pampered during the whole procedure. I wasn't charged for anything. The 10% were for the drugs, whereby the delivery, the session for the surgery, it was government, so off my neck. We didn't pay anything.
Lucy Imokalu is another enrollee who sought redress from the NHIA and got her money refunded.
Some time ago, around 2019, I went to the hospital and I was told that I cannot access my treatment because my HMO has not paid. So due to the nature of what took me there, I cannot go home without medication. So I have to pay from my pocket, and I received the medication. So when I came back to my office, I reported the matter to my person in charge of NHIS in my office. So I took it to our director. So the money was not much, but due to what happened to me that took me to the hospital, because I fell down in the office here, I was carried to the hospital. So that is why my director insisted that that money must be refunded, because she know that my office has paid. So they now took the matter to NHIS office, and it was followed up. Sometime last year during the lockdown, the money came to me, and it was a surprise to me, because that period, you know what was happening, what money was not at hand. Even though it was little, when it came, it was as if I received a million.
Patience Makama had her baby through the NHIA. She shares how the journey was seamless.
Though this is my first time, and I enjoy it 100%. From the one of my antenatal till delivery, everything was perfect. I didn't spend a dime because the antenatal and the NHIS was 100%. So, and I delivered this baby through CS. And after then, he was still admitted for jaundice, and there was no any charges since the NHIS covered him. That's why I come. That's why I'm here to add it up, so that he too will benefit from it.
Shitu Shehu Babatunde had an accident. He spent about 2 weeks in a hospital that was not his primary provider. He shares his story on how he sought for redress and got it.
While we were in the hospital, all expenses were paid out of pocket. After I was discharged from the hospital, my friend, a colleague in the office, made the move. He started the move for me. Yeah, he applied for everything, and the desk officer in my office has been following up. And there's one Ajia Fati in NHIS. She took the matter on her head very seriously. She has been calling me, going up and down, till the day I was finally settled.
There are more of such stories of enrollees who have benefited from the scheme, as well as sought redress and have been pleasantly surprised that the scheme stood by its core values. And that is what the NHIA is all about. For now, let's take your question answered. Do stay tuned.
Where do I register? How can I get enrolled?
Where do I register?
How can I get enrolled? How can I get enrolled?
Question: can an enrollee access healthcare services outside his or her state?
Yes, so we have a list of accredited healthcare facilities all over Nigeria, and you are entitled to, as a referral case, you could be referred from Abuja to access care outside Abuja. You could be referred to any hospital with the adequate skills, manpower and equipment to treat you in any part of Nigeria. But again, at primary level of care, you are restricted to one facility. And that facility is what we call your primary healthcare provider. So you are registered with healthcare with that particular hospital or health center, and you are to go there to access care at the primary care. That hospital is capable of referring you, like I said earlier, to any other hospital.
Where do I register? How can I get enrolled?
Where do I register?
How can I get enrolled? How can I get enrolled?
On that note, we end this episode of Easy Access to Healthcare for All Nigerians. If you're not a government enrollee registered on the NHIA platform, take advantage of the gift ship products of the scheme and get you and your family enrolled to access prepaid healthcare services. It's one sure way to avoid out-of-pocket expenses for healthcare and give yourself peace of mind. See you next week.